The 50th annual meeting of the EBMT is officially open. It's the event for everyone involved in the care of transplant and cellular therapy patients, and for the next 4 days, the place to be to discuss the potential these have to transform patients' lives. Catch it all right here on EBMT TV. Transplantation professionals from all over the world finally made it to Glasgow to what should prove to be a major milestone in the history of the haematopoietic cell transplantation and cellular therapy community. Today, though, as trainees from around the world get to grips with the meeting for the first time, we're taking a look at the next generation of transplantation. On today's show, we'll hear from trainee doctors and nurses as they detail what the future of their careers looks like.
It's a dynamic area of medicine and it's changing all the time, and it's really important that we give the next generation a firm grounding.
We'll discuss how centres are planning for nuclear accidents in Ukraine.
In some scenarios, not only Ukrainian healthcare system will be involved, but by Europe as well.
And continue our journey around the world to look at some of the leaders in haematopoietic cell transplantation and cellular therapy.
So to induce tolerance to the cells to fix a gene or to fix a disease, it would be a major step forward.
Make sure to watch it all on screens at the SEC, the meeting website and app, and on YouTube and X pages. First though, it's the Nurses Education Day, where they plan to highlight the journey of transplantation care by looking back at the last 50 years, as well as into the future. Let's hear from leaders within the EBMT Nurses Group and the attendees.
Today's really interesting because it's got a bit of a historical slant, looking back over transplantation over the past 50 years. And it's kind of nice to remember where we've been and what we've done.
Nursing has changed dramatically than what it was initially. I think especially the role of the nurses has changed.
But on the other hand, nursing stays the same. What is important for us as nurse and healthcare member to treat those patients in the best manner, so we can learn from each other also here.
The EBMT community within nursing is a huge aspect. We're able to network with other colleagues from across Europe, and we learn from each other, which is really important.
We see new nurses, junior nurses, senior nurses, people who are coming every year.
I've been here then for 10 years every year, and it's because of networking, and that's very important because we can learn a lot of each other, but it starts with knowing people in every country, and that's why I'm coming back every year.
The EBMT meeting is a great place to be for nurses because we can share our knowledge and can present our research and can connect internationally and nationally across Europe and meet people.
It's a great way to network with people, get to meet colleagues from around the country and Europe. To have nurses here and having a voice and a whole day, I think is fantastic.
For me, EBMT is a great pleasure to connect with other nurses and to get in touch with them and to get new knowledge.
The EBMT Nurses Group helps us to always keep updated on the latest evidence and to know what we can implement in our clinical daily routine practice. And so it gives a great opportunity to base your care at the latest evidence and to provide patient-centered evidence-based care.
EBMT gives me the information that I need to put into practice again and to settle up and to get more information how it is done in other countries so I can settle it up in my area.
First of all, I come here for the knowledge and also for connecting with other people. I think nurses have improved in the last 40 years so much, and that's because this kind of things like the EBMT, and that's why I'm proud to be here and to be part of it. I think that the nurses have a great role in improving the supportive care.
With it being the 40th anniversary for the Nurses Group, the 50th anniversary of EBMT, we're looking back but also looking forward to what's ahead of us.
Now for our first short feature for today. we take a look at an ambitious one-and-done approach taking place in California at the Stanford Center for Definitive and Curative Medicine, where they hope to treat patients only once in their lifetime for their disease.
I came to Stanford in 2014 to start the Center for Definitive and Curative Medicine. The whole idea was to really accelerate the translation from the bench to the bedside, leveraging the innovation, the cutting-edge science ongoing at Stanford to cure incurable diseases. Diseases with very high unmet medical need, for which cell and gene therapy can make a difference. And of course, we don't cure diseases, we cure patients.
The Stanford Center for Definitive and Curative Medicine is designed to support a broad spectrum of cell and gene therapies that give one-time cures that last the lifetime of a patient. It is an ambitiously named center because the goal is to be able to do this once and done and have them go away and maybe never even realize if they're a young child that they had the disease that they came for originally.
Since the outbreak of the war in Ukraine, the Ukrainian people have faced and met a huge number of ongoing challenges. The possibility of irradiation caused by a nuclear incident is one that fortunately hasn't been an issue yet, but Ukraine must prepare for. To discuss these plans and the work he's doing with the EBMT, I'm joined by Ukraine's Sergei Klimenko.
Thank you, Sam, for having me.
What does your work involve, Sergei, and how is this extending to preparing for nuclear incidents?
My colleagues and I understand that if radiation accident happens, we will be certainly involved because we know so well how to deal with bone marrow failure, how to deal with exposed people, and how to treat acute radiation syndrome. And we know this from Chernobyl experience. We should be prepared.
And what's the threat level so far, and what kind of incidents are we talking about, and have you had any so far?
Ukraine has very developed nuclear industry. We have 5 nuclear power plants, therefore it's very dangerous that some of these objects will be destroyed. It might lead to increase release of nuclear waste and nuclear material, and the whole entire Europe might be polluted with nuclear material. Luckily, it hasn't happened so far, and we also have to be prepared to nuclear weapon usage by Russian invaders, both tactical and strategic.
And so who would be impacted, and what care would they need in these sorts of circumstances?
Ukraine is a huge country with huge population, and if something happens, a lot of people will be injured. And we will face with a lot of people heavily exposed to radiation. And these people will certainly need hematological support. Some of them will need bone marrow transplantation as the curative option. So there will be certainly a lot of work to do, and I hope it will not happen.
So maybe you could give us some sort of specific examples of how you're working to set up the pathways to deliver the care and what it looks like from triage to hospital care, as well as the provision of donors, of course.
I have to say that physicians in general do not know the details on how to deal with radiation-exposed people. Therefore, it's very important to educate them. Last December, we did tabletop exercise with Nuclear Accident Committee of EBMT, aiming to educate hematologists how to triage radiation-exposed people using pocket guide developed by EBMT several years ago. It was very successful from my point of view, and I guess that hematologists are prepared and ready to deliver this knowledge to other physicians to be more capable to react in case of nuclear accident.
What's the feeling over there amongst physicians and amongst the people that you're working with in terms of how optimistic they're feeling or how concerned they are about this?
Physicians in Ukraine are quite optimistic and have a lot of experience during the war, and they are ready to react. They will react properly. We have the developed system of medical evacuation from battlefields, but I have to say that if something happens, it might happen everywhere in the country, and in some scenarios, not only Ukrainian healthcare system will be involved, but by Europe as well, because the radiation material might spread through the entire Europe.
If other people want to get involved, how can they do that? And also, what more do you need?
Of course, it might be stopped when war will stop. Therefore, any efforts which might help to stop this war are very important. And from other side, we should do our best to educate physicians. There were several webinars during last years on physician education in Ukraine. These webinars were organized by EBMT, by WBMT, by Duke University, WHO. So we have to do a lot. And joint efforts will be successful, and we will win.
Sergey, thank you so much for joining us. It's a real honor to have you with us. Thank you.
Thank you.
Coming up soon, we take a look at the disease group known as haemoglobinopathies and the promise of gene therapy. First though, let's go to a group also doing some groundbreaking research, providing high-precision cell therapies that aim for improved outcomes with fewer risks. We visit Orab Bio.
One of the biggest challenges in treating patients with blood cancer, specifically acute leukemias and myelodysplastic syndrome, are the patients being fit for transplant and the patients dealing with the toxicities after the transplant. Orab Bio's lead therapeutic candidate is meant to really address the toxicities of transplant, making patients who are already receiving a stem cell transplant, giving them better outcomes, as well as potentially widening the net for patients that we can impact. What motivates me at Orab Bio is really the products and the impact that they can have for patients. Even under the best case scenario, a conventional transplant carries tremendous risk and difficulty and complications for patients and for physicians to manage. The Orab products have the potential to deliver better curative therapy to these patients for a truly regenerative medicine.
With the advent of stem cell transplantation, the previously uncurable set of diseases known as haemoglobinopathies became curable. Decades on, we now face an exciting new future with the application of gene therapy to this area. To discuss this, I'm joined by Josu de la Fuente, Secretary of the Hemoglobinopathies Working Party, Nurse Representative Sandrine Bramantas, as well as the Severe Aplastic Anemia Working Party's Nurse Representative Kelly Hennessy. Thank you all for being with us today.
Thank you.
Thank you.
Josu, let me first come to you. Could you tell us, what do we mean by haemoglobinopathies and how has treatment progressed over the last 40 years?
Hemoglobinopathies refers to disorders where there is inadequate hemoglobin production that leads to lack of adequate oxygenation to the organs, and that leads to substantial organ damage over time. They are classified, broadly speaking, in two groups: thalassemia and sickle cell disease. And over the last 40 years, we have seen a substantial reduction in mortality in early life, particularly in the pediatric and adolescent years. However, we have had little impact onto the morbidity as patients go into the 20s to 40 years of age. And the overall survival is still significantly affected in comparison to the general population.
Sandrine, maybe I could come to you. Josu has just given us a resume of the last 40 years, but what does treatment look like for patients today?
So treatment today, so for our patients with sickle cell disease, the standard of care is to remain using the use of hydroxycarbamide. hydroxycarbamide is a medication that is used to prevent end organ damage. And we monitor the disease progression by using transcranial Doppler scans and then determine whether the need for red blood cell transfusions or other treatment plans. Patients with transfusion-dependent thalassemia will have regular blood transfusions, and the key part for them is the iron chelation treatment that they need, and also the regular monitoring of the iron overload by using MRI scans.
Josu, how effective is haploidentical HSCT for these patients, and how are you working to improve it?
There are two techniques currently, one based on post-transplantation cyclophosphamide and the other one on graft manipulation with alpha-beta depletion. Both are reaching levels of optimization to ensure good engraftment and minimizing graft-versus disease, to the point that we are very close to obtaining the same outcomes as in sibling transplantation.
Kelly, let me bring you in. How promising are gene therapies for haemoglobinopathies, and what's the state of the approach at the moment?
Yeah, so gene therapy is extremely promising for haemoglobinopathies. I'm the lead research nurse for gene therapy in our trust from the age of 5 to 12-year-olds, and we know from the age of 12 to up to 35-year-olds that it has been approved by regulatory bodies. So I think for those who don't have a fully matched HLA donor, that gene therapy is hopefully the way forward for this group of patients.
And what are you seeing with patients that are coming back to the clinic after a couple of years?
So we run the follow-up clinic in Imperial College for those patients, and the patients are now at least 2 years post-transplantation. They were able to return back to work after 3 to 6 months post-transplant, so a lot sooner than a standard transplant patient. It has been life-changing for them, and they are all big advocates of gene therapy and the positive impact that it has had on them to date.
That must be very rewarding to see that.
Oh, it is. It is great to see them to come back into clinic and to see how well that they're all doing.
And Josie, let me pick up as well about how excited you are on these new therapies.
It's life-changing to think that, having started my career where barely transplantation was possible for them, we are in a situation that any patient who warrants it and can run the risk of having a procedure, whether it's going to be high-dose chemotherapy, can actually access it regardless of the status of the donor. So I can see a future where all patients will be able to achieve a definitive cure rather than to continue treatment on a daily basis.
And let me just pick up on that point, Kelly and Sandrine, with you. What do you see for the future, and how hopeful are you that people can be effectively cured?
Yeah, so I do hope that this is the way forward for all our families, especially those who don't have a suitable donor and who we meet in clinic on a regular basis. I think that this will be life-changing for all of them and will have such an impact on especially our paediatric population as we see them go into adulthood.
Just to finish in one sentence, Josu, how optimistic do you feel for them, for patients being diagnosed today, compared to the past?
So these patients are identified with the newborn screening program at birth, and so they grow from the very first understanding of the surroundings, knowing that they have these disorders. They can see themselves in comparison to their peers and siblings, family members, and so to suddenly realize that they are going to be able to change that and find any differences between them and the rest of the world around them must be very, very encouraging. We don't know yet at this point whether we should be able to offer it immediately to everyone due to the complexity and cost of these therapies. But I think as we advance in the coming future, these treatments will become with wider availability, and one can see the future where everybody will be treated with a definitive cure.
Thank you all for joining us, and every success with the Working Party.
Thank you.
Thank you.
Looking ahead to the next 50 years of development of treatments and patient care in transplantation, we wanted to hear from the next generation of transplantation professionals. So, over to you.
Training the next generation in transplant and cellular therapy is essential in understanding the challenges we already face, but also we will face. especially with the new and complex therapies of CAR T cells, but also gene therapies.
We know that by nature of BMT and cellular therapy, it's a dynamic area of medicine and it's changing all the time, and it's really important that we give the next generation a firm grounding and equip them with the skills that they need to be able to integrate their own ideas, and ensuring that the field continues to move forward as it has done over the last few decades.
One of the biggest challenges in the beginning of your career is to have orientation about resources for education and for your professional development. And the EBMT helps young and early career nurses with exactly that, providing educational resources, for example, podcasts, books and e-learnings.
As a trainee committee, we provide a platform for trainees working in transplant and cellular therapy internationally to not only network with each other, but give them skills and opportunities in terms of accessing education and resources, and being able to come to meetings like EBMT to learn, share ideas, and ultimately grow and make ideas happen.
Last year we launched the Next Generation Nurses Group to help young and early career nurses to have an opportunity to engage in EBMT with their own topics, for example, career development and networking, and keeping up to resources from the EBMT.
I believe this is a very tough generation that faces a lot of challenges, but also a very hopeful generation that talks to each other, collaborates with each other, has fun together here in Glasgow and any place in the world. So I'm really looking forward to learning from the new generation and talking to them.
There's so much to do and so much to learn here at the 50th annual meeting of the EBMT. We can't possibly catch it all. So let's take a look at some of the highlights from Sunday. That's it for our first full day at the 50th annual meeting of the EBMT. And what a great start to the Congress it's been. If you've missed anything or want to watch one of our many great features from around the world, there are plenty of ways to watch. You'll find us on screens, the meeting website and app, and on YouTube and X pages. We'll be back again tomorrow, so do make sure to join us for our interviews with this year's Van Beckham and Basic Science Award winners. Plus, we hear from a local stem cell donor and much more. We'll see you then.